عندك
محاضرة.
Okay, so let's start. For example, you have question, name any three ACE inhibitors. So you can easily answer like lisinopril, fosinopril, captopril, enipral. They are ACE inhibitors. Mention three adverse effects of ACE inhibitors.
Cough.
Cough?
Hyperkalemia.
No.
Hyperkalemia.
Okay.
Angioedema.
Angioedema. Okay, good, Masha. Angioedema.
Angioedema.
Okay. Why ACE inhibitors cause cough? Why ACE inhibitors cause cough?
Because it's hydrolyzed bradykinin.
It hydrolyzes bradykinin, or it doesn't hydrolyze. Why there is cough with angiotensin inhibitors? Angiotensin converting enzyme hydrolyzes bradykinin, but if you block this enzyme, so what will happen to the bradykinin? The level of the bradykinin will go increase up, because it increases bradykinins in respiratory tract, so it will cause dry cough. Okay, ACE inhibitors can be replaced with whom? With
The name of
ARB.
Arabs.
Arabs.
Yeah, or if you want to name any Arab, like losartan, valsartan, almisartan, telmisartan, but better to write the group name. Okay, mechanism of action of Arabs.
It looks as you
Yeah. Angiotensin, 2 type 1 receptors. So that is the mechanism of action of
Arabs.
angiotensin receptor blockers. Okay. Any two, name any two Arabs uses. First one uses. Where do we use it?
in replacement to the ACE inhibitor.
The use. That is not the use. Because you mentioned where we use it.
Oh,
Yes.
Davis Smith.
Okay, diabetes mellitus. But what type of diabetes mellitus?
Type 2.
Hypertension, diabetes mellitus with hypertension, or hypertension with diabetes mellitus. One second, even hypertension. Simple. You can write hypertension and hypertension are cardiac diseases with comorbidities like diabetes mellitus. Okay. Its side effects. What are the side effects? Diarrhea, one.
Allah.
Because two side effects.
بس ما أعرف. I don't know what it's mean.
Just speak.
Strand associated and
Enteropathy, that is diarrhea, that's what he said. Olmesatran associated diarrhea. What else?
the same.
The same. So what is the same? Hyperkalemia or angioedema. Okay. So diarrhea is different. Rest angioedema, hyperkalemia is same, but it doesn't cause cough. Dry cough is not there. Okay. What is the contraindication? Where we should not use it? Pregnancy. Pregnant women. Good. Mention 3 clinical uses are indications of herbs. One is hypertension. Second, chronic kidney disease, heart failure.
Chronic kidney disease.
Yes. Next, olmesartan is N dash and can cause what? Yeah, but what the first first
Arabs.
Arab, yes, Arabs. Okay, levodopa is the drug of choice for hypertension, pregnancy associated hypertension. Okay, it blocks or antagonizes which receptors?
Beta 1.
Beta 1.
1 and
Alpha 1.
alpha 1. Good. Amlodipine is calcium channel blocker and can treat what? Amlodipine is, here what you can write, calcium channel blocker before calcium channel blocker. It is used where? Calcium channel blocker is, amlodipine is, that is mechanism of action, that it causes relaxation of the smooth muscles of the blood vessels as well as of the coronary blood vessels.
Amlodipine.
This is very simple, common sense question. It is anti-hypertensive. Amlodipine is anti-hypertensive, calcium channel blocker, and can treat what? Hypertension. So sometimes we put easy question and students think again what is coming. But it causes what as an anticipated side effect. Calcium channel blocker amlodipine is good anti-hypertensive. Bradycardia. Anticipated bradycardia, if you remember, we discussed less bradycardia as compared to beta blockers, but it causes something else very important. Amlodipine, that is nifedipine, gingival overgrowth.
Doctor, what do you mean by anticipated?
That we expect.
It's
We think that it will
expected.
cause.
Expected to come again.
What it will cause? Calcium channel blocker will cause what? If you remember, I told you some important, that any calcium channel blocker can cause headache, any vasodilator, because it is vasodilator, so it can cause headache, first one. Second one, it can cause constipation. But if you see in the lecture, even it is written, amlodipine cause ankle edema. Ankle edema. That is the most important. Why? Because I think we discussed amlodipine is used for years by patients and otherwise very good, very effective, but mostly patients develop ankle edema. That is anticipated side effect. Okay. Nifedipine blocks what receptors and can cause what as serious side effect?
Gingival overgrowth.
Gingival overgrowth, and it blocks which receptors? Yeah. Calcium receptor. Nifedipine. Nifedipine is the Nifedipine is the elder brother of amlodipine. It came before amlodipine. Okay. What is next? Yes. Why CCVS causes constipation? No, before this. Verapamil is and can be used in prevention and treatment of. Prevention and treatment of. First one, verapamil is calcium channel blocker, good, and can be used in prevention. Arrhythmias, good. Treatment of tachycardia. Arrhythmias and treatment of tachycardia. It acts more on which calcium channels? Myocardial or cardiac calcium channels. Clear?
Clear.
Okay. Why CCBS cause constipation and headache?
It causes constipation because it's stored in the calcium channels in the intestine.
Okay. And headache because it is vasodilator. Good. Okay. Is an effective, even effective in low GFR patients? Which drug is even effective? So GFR.
Glomerular filtration rate.
Sorry? Glomerular filtration rate is related with which drug?
Which one?
Yeah. GFR or glomerular filtration means urine production. So which drug is important in urine production? Karam dekhta hu. Yes. Just we discussed it 2 times. One in renal, and then we discussed the first group in antihypertensive. Diuretics. Which diuretic is used in low GFR?
Furosemide?
Furosemide. Very good. If you remember, I told even if the GFR is as low as 9 mil per minute, it can still be effective. Furosemide or furosemide. Good. Okay. Are cardioselective beta blockers? Here you can write 1, 2, 3 examples of cardioselective beta blockers. Cardioselective beta blocker means that will act on beta 1 receptor. So which one act on beta 1 receptors?
Selective.
Yeah, name. Prolol. Okay. Okay. And nebivolol. Okay. Metoprolol, bisoprolol, and nebivolol. Okay. Propranolol is non-selective beta 1, beta 2 blocker prototype. It can also cross blood-brain barrier because it is in nature. What is it in nature? Which drug crosses the blood-brain barrier? Drugs are of nature, either they are lipid soluble or water soluble. So which drug crosses the blood-brain barrier? Which is lipid soluble, lipophilic. It is lipophilic or lipophilic. Okay. If the patient is DM patient, diabetes mellitus patient, beta blockers are not advised. Why? Beta blockers are not advised. Look at the lecture, you will find the answer. Beta blockers should not be used ideally or discouraged in diabetes mellitus patients and asthma patients. Why in diabetes mellitus? What it will cause? Because it will reduce the heart rate. Oh, there is something special written. It will check the lecture. What does it do? Mask hypoglycemia, because it masks hypoglycemia, tremors and tachycardia. As you said, tachycardia, but the main thing is hypoglycemia.
What does it mean, that mask?
Mask means that the patient doesn't know that he is suffering from hypoglycemia. Although the blood sugar level is down, but still he does not realize. Why? Because for realizing, beta receptors will be stimulated, and that are not stimulated. Who is stimulating beta receptors? Adrenaline, and adrenaline we block by these drugs. So for this reason we say mass hypoglycemia.
So it's enough if we said hypoglycemia only.
Mask hypoglycemia, because hypoglycemia alone doesn't make sense. Okay. Oral iron supplements as best absorption. Which oral iron supplement is best for absorption? Ferrous sulfate, and are more commonly used to treat iron deficiency anemia, but have
Constipation, diarrhea.
yeah, many side effects. It has many side effects. Okay, where is next?
Doctor, one of the side effects, you feel like there is a...
Metallic taste.
Yeah, can I write like a metal taste or something like that?
Yeah, you can write. Okay. Next is ferric citrate causes less side effects, especially which side effect is less in ferric citrate?
Constipation?
constipation.
Yes, it's very.
Which one is less? Okay, and as better oral tolerability. Metallic taste is less. Metallic taste is less with ferric citrate. Better oral tolerability, this blank is not there. Okay, acute but harmless side effect of iron supplement. Blackening of the stool. Okay. Tranexamic acid is used to treat what? If you get question, write 2 or 3 uses or clinical uses of tranexamic acid. Where do we use it?
Hemorrhage.
Sorry?
Hemorrhage.
Hemorrhage, good. 3 uses. Yes. Antifibrinolytic is mechanism of action. Uses.
Surgery.
Surgery, before and after surgery. Hemorrhage. Third,
Tooth extraction.
tooth extraction, menorrhagia. All these are the uses. Mechanism of action of tranexamic acid. Mechanism of action of tranexamic acid. It blocks,
Lysin receptors.
it acts on the lysin receptors. It blocks the conversion of plasminogen into plasmin. Okay, so that is the mechanism of action, and that it will help in fibrin clot. 3 side effects.
Anaphylaxis.
Okay,
Thrombosis.
thrombosis. And third one,
Intolerance. Nausea. Vomiting.
nausea, vomiting, diarrhea.
Right.
Even if you write only these 3, no need for anaphylaxis and tolerance and these things. Nausea, vomiting, diarrhea. Yeah.
What are the 3? Thrombosis and...
Thrombosis, anaphylaxis, GI intolerance, or nausea, vomiting, diarrhea. Okay, there will be no question from anti-thrombotic, no antiplatelet, no anticoagulant, and no fibrinolytic. Maybe in final, but in this exam, no question. So this is your exam. Clear?
no short essay, you mean?
There is short essay.
But
I told in the last lecture, we take the first portion was antithrombotic. In antithrombotic, we discussed anticoagulant like warfarin and heparin. And the second one, we take antiplatelets like aspirin, clopidogrel. Third one, we discussed streptokinase, that is fibrinolytic. No question from that. There is short essay question, 1 short essay question. There is 3 faragat, fill in the blanks. And there are 8 MCQs, 8 multiple choice questions. So 8 plus 3, 11 plus 1, 12. No, inshallah, it's okay. Not, at least for pharmacology, if you can answer like this, inshallah you will answer.
What should they say?
1 short essay. For each subject, 1 short essay. 1 for pharmacology, 1 for physiology, 1 for biochemistry.
Why 3
Fill in the blanks. Yeah, very good, very good. I sent the exam to the exam assessment unit, and each MCQ is of 0.